Hello and welcome to Traditional Chinese Medicine. My name is Christina Kapothanasis. I am a traditional Chinese medicine doctor and acupuncturist in beautiful Honolulu, Hawaii. I graduated from the Shanghai University of Traditional Chinese Medicine, where all of my courses and year-long residency were completely conducted in Mandarin Chinese. My mission is to help people integrate Chinese medicine into their daily lives to promote wellness and health. If you think that anybody would benefit from this video, please share the joy. I'm also working on a course that encompasses every recommendation, food, lifestyle change that I have recommended to my patient, or a patient has asked me a question over the past 10 years. Many people ask me the same questions over and over, and now I am trying to amass this into one beautiful course and maybe other courses on case studies or whatever else I can think to help you in the future. So please check back in the description box or for my website for when those courses will come out. Today we are going to talk about a very important aspect of fertility treatments in terms of traditional Chinese medicine, and that is the use of progesterone to prevent miscarriage. Progesterone is such a lovely hormone that Western medicine uses to help women maintain their pregnancies, but some girls are more or less sensitive to hormones, and it is best if you are seeking treatments either through IUIs or IVFs to visit your local acupuncturist, because they need to check your pulses before and after the implementation of whatever level of progesterone your doctor prescribes. Today I'm sharing a small snippet of a case study of one girl who I saw this week, but she triggers at least a couple other girls who have had interesting progesterone reactions. So I wanted to share this with you because things come to me in threes. That's when I see patterns and I like to share. Okay, so this girl is, of course, female, born in 1982, trying to get pregnant. Before she started to see me, she's been trying since 2019, and she's been coming to me for several months. They found out, I asked her, a reproductive endocrinologist, to send her husband's sperm to the mainland to do the DNA fragmentation sperm analysis. I'm not sure if I'm titling that correctly, but some defragmentation sperm analysis, whereas I've learned over the years the regular sperm analysis that they do at the local clinics sometimes is worthless. One girl's husband's sperm was sent for analysis to the mainland and came back with like a 1% or a 0.1% chance of getting pregnant by herself. She had to do IUI or IVF because they check several different morphology and the shape and the speed and the count, but it's much more detailed than the local tests. So this poor girl finally got her husband to do his sample and send it to the mainland, and when they came back, she fell into that category. So he's been on the doctor's vitamins for a month or two now, and she went in for an IUI this cycle. Her pulses in general, she's a blood type A, 5'8", 128 pounds. Her pulses in general she came in with quite weak pulses, so I knew that part of it was her, but I definitely wanted to rule out the husband, because the husband's pulses sometimes good, sometimes really bad. He is a firefighter and they work long shifts to need to be on call and maybe up in the middle of the night, and of course not sleeping well is going to torch the swimmers. So we tried to work on him and we tried to work on her, but she's the one who came for the regular appointments with me. So at the beginning, her liver and kidney pulse is 25%, heart pulse almost 0, and her lung pulse was about 40%, spleen and large intestine almost 0. Her tongue used to be really thick in the beginning, and she used to have stagnation under her tongue. It used to be a little red, but now, definitely for a long time, her tongue has been beautiful, pink with a thin white coating underneath. The veins are nice and skinny. And then only recently, after we really pinpointed her problem, which I think is a lot of issue with the fertility girls, is the work stress, work and life stress in general, and not getting the quality sleep to make up for the stressors in the day. After she really started on focusing on rest and sleep and just cutting back as much as she could at her work, her previous, not this last one after she started progesterone, but the one right before she started progesterone, which was luckily the day she was going for her IUI, her pulses were pretty stable. I prefer 50% on spleen, liver, kidney, but she gave me 30%, 35% on heart, liver, kidney, and I said, okay, that's okay, you're quite thin, hopefully just a little dry, I hope that's good enough. And then her lung and her large intestine were quite weak, but her spleen was 35%, and I always joke with them, I only need your spleen, liver, and kidney for the fertility. So we were really excited going into the IUI. Dr. Dominguez, which I work with here as exclusively as I possibly can, sent her back with wonderful feedback, lining, follicle, hormones, everything was beautiful. And so she did the IUI and then started progesterone soon after. So when I saw her yesterday, she came in with her pulses, heart and kidney 25%, liver 35%. And I said, oh no, the pulses are tanking. Sometimes if you're going to implant around day 14, 1 week later, which is when the spleen and the energy need to kick in and make a lot more energy preparing for baby, and everything starts to go to baby. A lot of girls who are pregnant around that 3rd week of their cycle start to get really tired or their pulses tank. And I said, oh no, your kidney is starting to tank. And I said, oh, you're going to have to rest even more than you were. She came in with her lung, her spleen, and her large intestine all almost asleep. So of course I have a mild panic attack because I want to take good care of her and make sure that she's safe. And so we discussed different things that could have caused this, and we couldn't come up with an obvious change. Her food wasn't worse, she didn't sleep less, she cleared even more of her schedule. She still took her herbs, so I said, okay, well, let's do the needles first because that can give us always more information. So I did the needles to balance her pulses. I took them after, and her heart and her liver, heart stayed 25, liver went down to from 35 to 25, and her kidney was so overactive. It just kept, it's too strong. That's the easiest way to say that pulse. So strong. And I was like, oh no. What is wrong with the kidney? And then on the other side, I said, oh my gosh, at least I got your spleen back to 35, even though her lung and her large intestine wouldn't budge. And that was just after the initial insertion of the needles. I get that information, I discuss more with the patient, and then I continue tweaking the needles to get everything as perfect as I could. And I can't remember if I got her pulses perfect or not. But as soon as I saw kidney overactive, I said, oh, are you sure somebody didn't sneak dairy in you? Because sometimes that can be a kidney overactive thing. I said, or it's some kind of chemical thing. And she said, well, I did start taking progesterone on whatever, I think she said Friday, I think I saw her on a Tuesday. And I said, oh, it's the progesterone. I said, how many milligrams are you taking? Because sometimes a higher dose can be prescribed than the patient can handle. but there's no way for Western medical doctors to know that. So she quickly went home, looked, and texted me, and it was 200 milligrams. So I had her call Dr. Dominguez and request for 100 milligrams ASAP. And then I will see her Friday. Today's Wednesday, so I'll see her on Friday and make sure that she continues doing her rest, and we reduce that 200 milligrams, and hopefully her pulses will calm down and we can get them to their beautiful at least 35%, so she can almost pass, so that this cycle has a better opportunity to be successful. I knew that it was a progesterone because there's another girl which also dried her digestive system pulses out. So it just torched the body, and the kidneys were having a really hard time filtering it. And then if that spleen goes to sleep, spleen is for miscarriage prevention. It keeps things up and in. If that's frequent urination or diarrhea or a fetus or prolapsed organs, it's the up energy, so we can't let her spleen go to sleep. And she made me think of another patient that I had just this fuzzy memory now, maybe a year or two ago. She really tried hard to get pregnant. It took her almost a whole year, I feel. And then the doctor gave her progesterone also to prevent miscarriage, which is fine. But I said, oh my goodness, why are your pulses so slippery? Because she had rheumatoid arthritis, which already tends to slippery pulses in the blood, but she was so strict on her food and so good on her herbs, and I had her relatively stable. So I drilled her, of course, to make sure she didn't eat anything wrong. But then we went to, oh, well, she just started progesterone. Let me see how many milligrams. 400 milligrams. And I was like, 400? I was like, wow, I feel like 100 or 200 is all I hear. I said, you better call them and make sure that that's not too high, because you obviously cannot handle this if that's the only thing that changed. And she called back to her doctor, and the nurses, in a frantic way, said, oh my goodness, 400. No, that should be like 200. So they immediately cut it down to 200, then her pulses calmed down. So that traumatizing experience will be implanted and tattooed into my brain forever. So now I'm very careful for that progesterone dose. But then on the flip side of things, three people. So the third girl, she tried fertility for a long time. She kept harvesting. She just wanted to keep harvesting, freezing. And finally, when she did try, her pulses going in were good, which was quite amazing, because she's a PhD student, very intellectual, always put her liver and kidney pulses to sleep, I assume thinking too much. And amazingly, maybe it was because of COVID, I'm not sure, that she didn't research as much, or she just let her hair down a little bit, but her pulses were lovely. She went in for the transfer, and it was successful. How exciting. Yes, she was prescribed progesterone, and then I saw her liver and kidneys start tanking. I was like, oh no, oh no, oh no, because she didn't have enough reserves. Her pulses were only good for a short while before going in. And you need all that extra energy, because the baby's just going to take everything you have and put it to baby, which of course as a mother you want to give everything to your baby, but you need to have enough to give to them. So she experienced some kind of symptom. I don't know if it was spotting or lower back ache, or she was just nervous, but she went back to the doctor and was like, how much of this progesterone can I take? Can I increase? Can I increase? Can I increase? I think she asked for increase 2 or 3 times, and every time she asked for increase, those liver and kidney pulses that were starting to tank, boop, they would come right back up. And then they would start to tank, and then boop, right back up. And I just checked on her for Thanksgiving or Christmas, because her husband's job made her transfer and move to the mainland, Texas, I believe. And I text her, and she sent me a picture of this beautiful big belly. So she's having a wonderful, easy breezy pregnancy and very excited for delivery. But anyway, I just want to show you the range of some girls who are very depleted in a cold way, can handle a lot of progesterone, and maybe they need more of it. And then there's the girls, the majority of girls in the middle, which are handling 100 to 200 milligrams. But if you're sensitive and you have a hot or dry constitution, like the rheumatoid arthritis girl, definitely they tend to be more slippery and hot. And this poor girl is just dry and depleted. We cannot torch them to death with too much progesterone. I don't know if that will help you to go to your acupuncturist and monitor your progesterone dose, but I hope that somehow it helps you to have a more successful and safer pregnancy for your baby, and that is my whole goal, is to help people. So thank you so much for watching, and until I have something more exciting to share, mahalo, bye-bye.